The title of our presentation is Escaping Nursing School, Simulations Geared at Improving Knowledge and Practice-Ready Skills. Our names are Lane Buus, Kenna Sandblast, and Riley Dowdy.
Our PICO question is, in nursing students who partake in an escape room simulation, does the post-simulation test score compared to the pre-simulation test score demonstrate improved knowledge acquisition and practice-ready skills? We chose this topic because we are interested in making nursing simulations a little bit more fun and a little less stressful. We have all participated in public escape rooms and found them to be entertaining, so this topic was exciting to learn more about. Online escape room simulations increased in popularity in some nursing schools when COVID hit, since students were no longer able to be in the hospital setting. So schools had to get more creative on how they were going to have the students apply their knowledge. While COVID brought out both online and in-person simulations, in our research we focused specifically on in-person escape room simulations. Some background and key terms for our topic are: escape rooms are defined as adventure activities that allow participants to solve hidden puzzles in collaboration with a group while in a locked room. Another key term are knowledge acquisition. This is the process of absorbing and storing new information in memory, gauged by how well the information can later be remembered. Another key term is practice-ready skills. These are critical thinking, communication, and teamwork. The use of simulators to replicate real-life scenarios leads to experiences that are more realistic and have been used to offer students an opportunity to assess, intervene, and evaluate patient outcomes.
During our search for the evidence, we were hoping to find research articles that contained higher levels of evidence. However, because our topic is so new, all of the research studies were either Level 3 or Level 4 evidence. Level 3 evidence means that there is no randomization in the study. Level 4 evidence means that the study is qualitative. Therefore, the results are an analysis of subjective feedback from the nursing students who participated in the escape room simulation. Additionally, all of our research articles are from the past 2 years. The first research study is called An Escape Room Simulation Focused on Renal Impairment for Pre-Licensure Nursing Students. This was a Level 3 quasi-experimental design where students took a pretest and performed a simulation on acute kidney injury, and after the simulation, they took a post-test. The results of this study concluded that this type of gamification strategy was effective in supporting the application of knowledge gained from the classroom, and this was evidenced by statistically significant increased test scores and by student feedback towards positive experiences with the nursing simulation. The second study is called The Impact of an Escape Room Simulation to Improve Nursing Teamwork, Leadership, and Communication Skills, a pilot project. This study is a Level 4 mixed methods design in which non-traditional students, which is defined as 25 to 64-year-olds, piece together a puzzle to work through a nursing simulation. This study had statistically significant evidence to prove that escape room simulations improve teamwork and leadership, and additionally, they found that this is an engaging teaching method to master teamwork and leadership skills. The third research study is entitled Escape the Generational Gap, a cardiovascular escape room for nursing education. This study is a Level 3 non-experimental mixed methods pilot study. In this study, junior level nursing students were taught cardiovascular material, performed an escape room simulation, and then had a focus group after the simulation. The post-knowledge assessment scores of the simulation had statistically significant evidence to show that the escape room simulation increased knowledge retention of cardiovascular content. The fourth study is called Soft Skills and Implications for Future Professional Practice: Qualitative Findings of a Nursing Education Escape Room. This is a Level 4 semi-structured focus group qualitative study, where 57 junior level nursing students participated in an escape room simulation about cardiovascular care. The results of this qualitative study found that nursing simulations improved learning outcomes, soft skills, which include confidence, critical thinking, constructive correction, and communication. And it also found that it improved implications for future professional practice. The fifth study is called Using an Escape Activity in the Classroom to Enhance Nursing Student Learning. This is a Level 3 quasi-experimental study with 132 senior level students who used clues involving NCLEX-style questions, riddles, puzzles, and math. The results of this study found that the escape room was a successful way to allow students to grow in their learning and to be able to apply that knowledge into the real clinical setting. The sixth study is called Students' Perceptions of Participating in Educational Escape Rooms in Undergraduate Nursing Education. This is a Level 3 quasi-experimental study in which 152 bachelor nursing students from a New Zealand nursing certificate program participated in an escape room simulation. The results of this escape room simulation concluded that the experience was memorable, challenging, and frustrating, and also allowed students to learn about themselves under pressure. Overall, the students stated that this was a positive experience for them.
Overall, our study showed that there is highly probable evidence to support the use of escape room simulations in nursing schools. All of the studies we researched reported positive outcomes of these simulations. This is proven through the pre- and post-simulation test scores, indicating greater knowledge acquisition of the previously taught material and better skill performance. Even though all of the studies that we researched showed good outcomes, further research needs to be done. Each of these studies consisted of small group sizes, and they were performed at one specific university or college. Larger and broader studies should be conducted to generalize the results to the rest of the United States. In order to apply our research to nursing practice, we need to disseminate our results and help generalize the results that we have created. Because this topic only applies to nursing students, the results will not be shared in the traditional hospital setting or with patients. We plan on sharing our results with the faculty and lab facilitators of Carroll College first, and work with them to design our own nursing escape room simulation to see if they improve our students' knowledge acquisition and skill performance. Another application of our findings would be to include a standardized study that incorporates the findings of the smaller studies that we researched. One example of a more comprehensive study would be to create a kit that would allow schools to have the software, supplies, and directions to perform the study in their own simulation laboratories. This kit would also include a pre- and post-test that would accurately evaluate the improvement of student outcomes. In order to clarify the process as well as the purpose of the simulation, a video showing an example of the simulation would be included in the kit. This video would also include education on the effectiveness of escape room simulations in increasing knowledge acquisition and practice-ready skills and the learning outcomes of the simulation. These outcomes could include teamwork and collaboration, communication, knowledge of the problem, and skills in order to perform the tasks. The use of one consistent escape room across different nursing programs would disseminate the findings of the smaller studies in order to obtain more accurate research results. Thank you for listening to our research on nursing escape room simulations. We would like to thank Professor Stephanie Burkholder and the Carroll College Nursing Department for their guidance in our evidence-based practice systematic review.